everybody to your podcast, Trends of the Moment. For today's podcast, we are talking about the COVID-19 situation and how people are facing this pandemic. The virus is affecting the entire world. Mortality rates increase every day. Pay attention of this data. Currently, worldwide, we have more than 14.3 million cases confirmed and more than 604,000 deaths. In the US, we have had more than 3.7 cases confirmed and more than 142,000 deaths. Good morning, Lorena. Wow, these numbers are crazy.
Good morning, Dario, and good morning, everybody. Yes, these numbers are incredible. The COVID 19 disease has not decreased in intensity, and many states have closed some economic activities again due to the increases in the cases. For example, in Florida and California, we see thousands of new cases every day. For the reason, the government closed restaurants, beaches, and other indoor activities until further notice.
Today, we are going to know how two guests have lived through this pandemic month. And finally, we will have a special guest who will tell us about the current situation that is being experienced in hospital in Mexico due to COVID-19. Our first guest currently lives in Salem, Oregon, and her name is Anageli. Welcome, Anageli.
Hello, everyone. My name is Anayeli Rodriguez, and I'm married, and I have 3 kids. And I'm currently living in Salem.
Can you tell, Anayeli, can you tell us how this COVID-19 pandemic affects you and your family?
Yeah, of course. We have been affected by this pandemic because I have lost my job. My husband working hours have been reduced. My kids' school have to be closed. Everything has really stressful, and it was really hard for them to be in online school because they didn't understand what was happening, and for me to deal with their homework and trying to help them to do it.
Wow, are you currently afraid that you or your family will get sick?
Yes, I am so scared to take my kids to anywhere. If, for example, if I need to go for lunch or something that we need in the house, I prefer to take them with my parents or just to wait for my husband to come home so he can take care of them.
Thank you, Anayeli, for sharing with us what you have experienced in recent months due to the COVID-19. Our second guest lives here in the US, but her whole family is in Guatemala. Her name is Erika. Welcome, Erika.
Hello, everybody. Thanks for inviting me.
Erica, can you tell us a little about you and if it has been difficult to face the COVID-19 situation we are currently going through?
Of course, my name is Erika Siliesar. I am from Guatemala. I have been living here in Salem for 6 months. All my family live in Guatemala. For me, these months are being very difficult because of the COVID-19. I can't go out to distract myself since I am afraid of catching it. I was even falling into monotony, but luckily I found out what to do to avoid it.
What did you do not to fall into depression in these times of pandemic?
The first thing I did was to break the circle of doing the same thing every day, like a routine. For example, I always get up early, take a shower, have breakfast, and study. Then watch TV and whatever else more I do. So I started to wonder what I like to do but didn't because of lack of time. Now I have plenty of time because I am working at home. So the time I use in driving to the office now, I have it available. Then I thought I need to dedicate time to myself, to know myself better in order to grow as a person and being happier than I already am.
Incredible, Erica. What activities are you currently doing to be well emotionally and physically in this time? Them.
Okay, I started to walk 2 or 3 times a week around my neighborhood, and I really enjoyed breathe fresh air, looking at the beautiful gardens. And I also start looking up for a game on the internet to exercise my brain and at the same time entertain and distract myself. I found one game that helped me with memory and also helped me expand my circle of virtual friends. In conclusion, all these activities help me take care of my body, my brain, and my spirit. And I am sure they would be good for you too.
Thank you, Erica, for sharing your story. Now, our last guest. Her name is Beatriz Rangel. She's a nurse, and 2 weeks ago, she traveled to Mexico to help with this whole COVID-19 situation in two government hospitals.
Hi everyone, thank you for having me.
Hi, Beatriz. Thank you for taking that call because we know you are very busy right now. Okay, the first thing that we want to know is how and why did this trip to Mexico take place?
Okay, I am Mexican, but I was living in America. The government of Mexico connected me in an emergency to help them with this situation of COVID-19, and I couldn't say no. In Mexico, to be a health worker is a big challenge now because of coronavirus. We have different and complicated illness every day in our hospital, but now with COVID-19 is getting worse.
Wow. Hi, Beatriz. What kind of hospital do you work in?
Oh, Lorena, I usually work for government hospitals. In the afternoon, my job is for people who don't have insurance. They are vulnerable because they are poor. It means they don't have enough money for food and health. At night, my job is for people who have insurance. They have better economic situations, but they also are getting sick.
And Betty, can you tell us how was your life before the COVID-19?
Okay, I was working every day hard because life is like that when you decide to work for helping others. But every day sometimes makes me happy and satisfied with myself.
And what is the difference now with the COVID-19?
I also still working hard every day and I love working as a nurse, but it's totally different because I know I am working close to COVID-19 illness and I am exposed to the virus. I don't have enough and basically medical supply for work. That means my coworkers and I are the most vulnerable. I am talking about everyone who works in the hospitals. I need to buy my own medical supplies like a mask, gloves, and hand sanitizer that resources are based to work. About how many patients take care is like the double done that I did before of COVID-19, and I am so tired.
Are you afraid of getting sick, Beatriz?
Yes, I am afraid. Every single day I am fearful. My coworkers are getting sick and they work in the same we work in the same area, which scares me. I avoid visiting my family because I am in the hospital and I am afraid to carry the virus and I am alone at home.
Beatriz, what kind of medical supply does the hospital usually give you?
The hospital usually give me a N95 mask a week, like a person protection. Then I need to buy everything to keep me safe, the same as my coworkers.
Do you have any recommendation to prevent COVID-19?
Yes, I do. Wash your hands by soap and water or hand sanitizer frequently. Wearing a mask correctly means cover your nose and your mouth. Keep social distance. Avoid touch your eyes and nose and mouth. If you can, please stay at home. Thank you for your invitation. I just want to say stay at home as much as possible. Keep your mental health and follow the recommendation to avoid COVID-19. Please don't forget if you have previous medical conditions like diabetes, obesity, and heart problem, you should be the most careful to yourself because you are vulnerable. People in the hospital are working for you and we also want to be safe.
Wow, amazing recommendation, Beatriz. Thanks for you for sharing this experience with us. Today's program has been fantastic, but we are running out of time. See you tomorrow on the next podcast. Stay healthy, Lorena.
Bye, everybody, and see you tomorrow. Stay strong and stay healthy. Bye. Thank you.
Bye, everyone.